Hi, I'm JR. I'm one of the staff nurses here in London, specifically in King's College Hospital. So, like 2 months ago or 3 months ago, my ward became a COVID specialized ward. So, we cater 25 COVID-19 patients. That's a total bed that my ward is able to have in a day. When COVID-19 struck us, we kind of got hit hard. I mean, in a way that we weren't really that prepared for it. I know the whole country wasn't really that prepared. I mean, in terms of supply of PPE, in terms of the guidelines as to what we're going to do, the testing and all that. But I guess I'm gonna be focusing on my side of the story as to why this has been very difficult. It was late March when I had the first ever encounter with a COVID-19 patient. So the patient was suspected for COVID-19 back then. That was my first encounter. And this patient has been confused as well. So it was really hard. I mean, number one, to control the patient. The patient was very impulsive, trying to get out of bed. I mean, he's very at risk for falls. And he's got COVID, he's been coughing all over the place. The condition alone of the patient, and then having the risk of having the healthcare professionals contracting the virus itself, it exponentially increased the difficulty. I felt really unsafe to handle that patient. I have my family, and I just wanna, like each and every day, I wanna go to work, come back home safely. But during the COVID times when we were handling COVID-19 patients, it wasn't the case. Like, you feel like you're very, very much at risk of having the virus and then spreading it to your family, which is the last thing that you wanted to do. So I have my 3-year-old daughter, I have my wife as well. Unfortunately, when I had symptoms for COVID-19 during my first encounter with a patient, like 2 days or 3 days after that, I already had the symptoms. I've been coughing, I lost sense of taste. I had low-grade fever, but not considered high-grade fever though. I got body ache, I was fatigued. I mean, to be honest, I'm not really quite sure. I'm not really 100% certain that it was COVID-19. But one thing I can say is that it was different. Like, it wasn't the regular flu. It was such a nightmare. But the worst thing is I passed it to my wife as well. So my wife has been having the same symptoms. Actually, she's got way worse than I did. We live in a one-bed flat. We're currently renting here. It's a one-bed flat, so there's not much space. I mean, obviously, we cannot do social distancing here. It's just the three of us. I had the symptoms. My wife had the symptoms. I kept on contemplating was spreading the virus to my daughter, or my wife spreading it to our daughter. It has been very difficult. I was off sick for 7 days. I went back, so we're handling 25 patients, and apparently they're all positive for COVID-19. They got symptoms, they were coughing, they got fever, they need oxygen support, and some of them, unfortunately, were confused. They were all over the place. They were difficult to please. They were very needy. They were wandering. And I greatly think they were the most difficult patient during that time. I mean, the confused, coughing, and non-compliant patients. Trying to say to a patient that he needs to stay in bed because he's got COVID-19. I don't think anybody who's got dementia would learn what COVID-19 is. Yeah, and it's, I don't know, it's understandable that they won't know. They just need to do what they need to do. Like, if they want to go to toilet, they just randomly would go to toilet. I just had like 2 shifts, and after 2 shifts I already developed symptoms again. So I had to stay away for another week. I came back to work, but during those times I had to request matron, I have to have accommodation, because the last thing I wanted to do is to spread the virus again. If I ever had the virus, I don't want to spread it again to my wife and my daughter. I had the accommodation when I was working, so I had it for each and every time I go to work. I've been having it for like 2 to 3 nights. So I stay in a hotel room, and it was nice. Like during that time, I really felt the support of the trust. Like each and every time I come home, I have to make sure that I already washed myself properly, and I had to wait for like 8 hours. Before coming home. Some of the nurses actually that I know, I mean not here in this country maybe, but in other countries like the Philippines, they opted to stay away like temporarily for a month or 2 or 3. I know some who stayed away since February, and up until now they were still away from their family. But one thing I'd noticed is that the numbers of COVID-19 patients has been decreasing. Like our ward already was converted to a regular non-COVID ward. It's a clean ward already. But we'll never know that, unless we test the patient properly. Because some of the patients will come, they will say, oh, they were safe to be there, they're clean, they haven't had any symptoms. And then suddenly we will be struck by the certain news that, hey, this patient got COVID-19 according to the laboratory, like swabs or x-ray. I don't know, I think as if we're playing Russian roulette at some point. Like we don't know who's who. They're just saying they're clean patient. Okay, we're gonna say okay, we're gonna accept the patient, but you know. And the bad thing is that obviously we weren't wearing the proper PPE because we're a clean ward. Has it been easier? Yeah, I think it's getting easier, and it's getting bearable for nurses. Yes, I greatly think. What am I doing now? So I'm asking myself. So what am I doing now? I've been doing bank shifts in ITU as a support nurse. So basically, what that entails is that I get to learn the setting of the ITU. I mean, not the role itself, like as an ITU nurse, because I wasn't really trained for it. But at least I get to see how they do things, how they use the machines, what type of machines to use, or the basics, those kind of things. It was very fruitful. All I can say is that I get to learn each and every day that I go there. So for those who are still there, who's still out there trying to combat this disease, try and be more vigilant. And like I always say, be still and be strong.